community-based health and wellness organization. Yeah, you know, those two right there. Yeah. Yeah. Come on in. You got it. Wellness organization dedicated specifically to addressing Black health inequities related to maternal and infant mortality. Jessica serves as Root CEO and clinical director, and Dorian serves as Root's COO and policy director. I did a little research on the stat. Listen to the stat here. Since 2015, Root has achieved and sustained 0% Black infant mortality rate, and currently serves as a subject matter expert for White House staff, congressional leaders, state and local government, Central Ohio hospital systems, and various national and local community stakeholders. Let's give it up. Next, I would like to bring up somebody you've seen on the stage, seen on the big screen there, who had a chance to be filmed here in the movie, Miss Shawnee Benton-Gibson. She is the co-founder, give it up for her. She is the co-founder and CEO of Spirit of a Woman Leadership Development Institute. Ms. Benton-Gibson is a licensed practitioner with over 31 years of professional experience. She's also the co-founder of ARIAH Foundation? ARIAH Foundation, the advancement of reproductive innovation through artistry and healing. Shawnee's expertise ranges across the board with treatment, recovery, development, all that good stuff. And according to Shawnee, doing healing work is a labor of love and liberation. Let's give it up. All right, I want to bring up, hopefully I pronounced this right, don't get mad at me. I was practicing. Jatu Boikai. Dang it, all got close. Ms. Boikai is a nurse manager for maternity services at Mount Carmel Health Systems. She has been a nurse for more than 12 years and has been in healthcare for over 18 years. She has a passion in women's health, and she has spent the majority of her nursing career in labor and delivery and mother-infant nursing roles. Let's give it up for Ms. Boikai. Without further ado, I want to bring up our moderator, the reason why we're here today. Let's bring up our commissioner, your commissioner, Commissioner Erica Crawley. Give it up. She has spent most of her professional life making a difference by serving others and giving people a voice through her service with the U.S. Navy and her working in advocacy on behalf of children and families. She's been a part of the Cuyahoga Family Job and Family Services, YMCA Head Start, Early Head Start. She's also been with the Black Children Development Institute, and we share a kindred spirit where she's a parent of twins. I have twin girls also too, so we definitely vibe out for that. But the work that she has put in on this, she actually hosted a CMC conversation earlier today. Many of you probably were at the lunch that we had here. But very, very passionate about this topic, which we all are, and we're looking forward to having this conversation. So without further ado, I'll be back up after we get done to tell you about the refreshments, but looking forward to this conversation. Let's bring up your commissioner, Commissioner Erica Crawley.
Thank you for that introduction. Thank you for my panelists for being here with me today. Thank you to COSI for being a partner with Franklin County in raising up this issue here in our community. It impacts all of us, and whether you are directly impacted or indirectly, we are all inextricably linked. And so we will continue to have these conversations as we try to figure out at Franklin County how we can save lives every day. We have a model, every resident, every day, but I always take it a little bit further and say that we want to ensure that all of our residents, our neighbors, can thrive and not just survive. And so before I pass it off to my panelists to talk about how they are coming to this conversation as I did earlier, I just want to say this is my first time watching the documentary, and I know we talked about it a little bit earlier at CMC, but I was purposeful in not watching it just because it is traumatic. sat on a panel a few months ago at the Large Urban County Caucus with NACO, the National Association for Counties. I had the honor of serving on a panel with the director of Aftershock and another community member who has an organization in this space. And got to share my own lived experiences, but how I come to this as an elected leader and why I ran for office. And after that conversation, my Administrator Wilson, was like, we would definitely have to have this conversation and in this community. But I just want to acknowledge, and I didn't say this earlier when I talked about coming to this conversation, I wouldn't be in this conversation if it wasn't for Jessica and Dorian. Because as Dr. Neil Shaw said, and I've been in conversations with him personally, that it is traumatic and that the birthing experience stays with us. And until I didn't even meet Jessica when she reached out to me to invite me to an event that her organization was having, to talk about your childbirth experience. Mine was so traumatic that I had never shared it. I had my twins in 2004. I was 23 at the time, and it wasn't until 2018 that I was able to talk about what happened to me. I felt like nobody understood it. I was embarrassed, and it's like it happened yesterday. I went into preterm labor at 18 weeks. I drove myself to emergency. Had to have an emergency surgery, a cerclage put in, went into surgery by myself, and then was in the hospital for 16 weeks, had some complications during that, and then the day that I got my cerclage out, I had been exactly 34 weeks. That day, they told me I would go into labor actively on my own. That was a Wednesday, and that I'll probably have my twins on Sunday. That was 10 o'clock in the morning. At 2 o'clock in the afternoon, they said, we're taking these babies. Nobody talked to me. I had no plan. I didn't know what was going on, and that happened. And then 5 days later, I stayed in the hospital 5 days, got out. My parents moved me from Atlanta at the time, and I came to Ohio because I didn't have any family, so they were like, you're gonna be with family. I was dealing with extreme pain. I couldn't even stand up. We went to the hospital, my mother took me, and we were in the waiting room for about 8 to 10 hours. And I was like, I'm breastfeeding and pumping, and because my children are on a special formula, so if they're early, they're underweight. I'm like, I don't have my babies. Can you tell me what's going on? And they were like, you'll be okay. Here, drink some barium, and we'll do an MRI at some point in time. And for them to do an MRI at some point in time to say, you just got a pocket of blood collecting in your pelvis, you can go home. You can take some over-the-counter medication. You'll be okay. And I couldn't even share that. And it was like it was yesterday. But Jessica reached out and invited me to a meeting. And I couldn't do this work and be an advocate in this space to try to save lives because I just happen to be fortunate. That's not everyone's experience. But that's how I come to this conversation, because you created the space where I could show up and no longer be ashamed and do this work every day to save somebody else's life so they don't have to go through that. So I will kick it off to you all. If you want to start, Dorian, on how you come to this space. And I know Shawnee will, because she did it earlier, so I don't want to steal her thunder in acknowledging the land in which we're standing. So I'll still leave that for you.
This seems like I'm going out of order if I go first. So, Jessica, you take off and then I'll go after you.
We haven't talked
Chivalry's not dead.
we haven't talked about that in a long time.
No.
We haven't talked about that in a long time. Started a very interesting relationship and journey. So I'm Jessica Roach. And yes, we have Restoring Our Own Through Transformation, also known as Root. We have been an organization since 2017, and since that point, we do maintain a 0% Black maternal and infant mortality rate. We serve Black families, and we are very clear about making sure that we serve the family as a whole. We think that that is the main reason that we have the success that we do. We believe that that is the main reason that we are able to have the stories of joy instead of the stories of constant tragedy. And how I come to this work personally, and it's always really challenging to discuss because we sit in these seats of having to do the work all the time, right? I've got a story, he has a story. You're sitting, you're looking at it. What's striking me is that we have a panel of professionals that don't meet any of those social determinants of health or the stereotypes that are always used against us. And all of us have an experience in this space that was traumatic, steeped in racism, and dismissal. And so I'm here because I come from a long line of great Black midwives, women who've trained me. I'm here because I love our people, and I worked as a midwife, I've worked as a nurse, I've worked as a doula, I work as an advocate. Nothing has been more fulfilling than to be able to do this work in the way that we do with Root, to be able to bring all of us together in a way that continues to not only address the health issues and those health disparities and the stories that they always want to talk about, but really sit in the place of advocacy and put our voices first, regardless of what the systems and the hospitals say about us.
Good. Okay. So I'm going to steal something that we kind of play back and forth off of. How I got to this work. First and foremost, I'm a Black man. I'm a father. I'm a grandfather. I'm an uncle. I'm a policy guy. I'm a community guy. I'm an educated guy. A lot of folks call me an expert on a lot of different things. But I was valid at Black man, remember? And so as a result of that validation, I didn't have an opportunity to resist doing this work. The ancestors pushed me in this direction. Period, end of sentence. Thank you.
Ms. Shawnee?
Yes. So when I came into this space earlier, I was sitting, on the first row and could hear sniffles behind me. I want to acknowledge the tears of the folks that are in this space, the tears that were shed and the tears that were held back, right? Some of us have tear ducts that have atrophied because we've been taught it's not okay to cry, and definitely not in public, and definitely not where we work, and definitely not in front of our children. So thank you for your tears, because I consider them libation. So whenever I lead in spaces where I'm able, we pour libation for the ancestors. My daughter is now one of the principal ancestors in my life, the one I held in my womb. And so I know her best. Not my great-great-grandmother and all of those folk, powerful presence in my life too, but I held that girl in my womb. So I know when she shows up better than any of the others. So thank you for pouring libation before we even got here. And also I acknowledge the folks who came way before we were even thought about, the folks who gave birth, who bled into the soil, who tilled the soil and had harvests, who died ceremoniously. And then when white settlers came, and when I think about settlers, they're really unsettlers, right? Disturbing the peace on all levels. When they came, dying unceremoniously, being treated like property, like animals. And so I speak the names. I forgot that the Shawnee, same spelling as my name, were part of this land. That the Delaware and the Miami, and some, y'all call out the other names, because sometimes I have these menopause moments. Yes, Wyandotte, thank you. Any others? Seneca, thank you. Any others? All right, and just acknowledging that they were duped, they were tricked, they were coerced, and even if there was an exchange, it wasn't an equitable exchange. So we are transforming and decolonizing our minds about what it means to own land. We don't own shit, right? We've been duped by that. All of the sectioning off and the gating up and the my deed and my mortgage. We don't own a thing. And Mother Nature is snatching our edges. For those of you who know what I mean, you know what I mean. And those of you who don't, ask me later, or don't, ask somebody else. You might be able to Google it. So So thank you all for holding space while I do that. And I'll say this really quickly. What has me be here? I want to acknowledge my mother, who's still living, Jill, whose womb I was housed in. And it was a turbulent house because of her depression, and she had severe postpartum depression and psychosis after she gave birth to me. And while she was pregnant, she was depressed as well. I acknowledge my grandmother's womb, Jill's mother, for housing Jill. My grandmother's an ancestor. Her name is Joyce. I acknowledge Cheney, Joyce's mother. She housed Joyce. I acknowledge Trellis, who housed Joyce. I acknowledge Mary, who housed Trellis. And I don't know the other names, but I know they existed because the womb inside of a womb, inside of a womb, inside of a womb, infinite, infinite, and I'm here.
So my name is Jatu. Thank you for having me. I think I realized that I was having some imposter syndrome. We talked about that, and I realized why just now, or maybe a little bit ago. I've been in Columbus for 3 years now, and seemingly I sort of jumped on the scene, and here I am. But I sort of wanted to give a little bit of a background as to where I came from and why I'm doing this work. So I grew up in the Bronx, New York. My background is Liberia, West Africa, and for those of you who know some of the history of Liberia, it's a very complicated history. Liberia was formed by freed slaves, so I have slave blood running through my veins, and I have indigenous blood running through my veins, indigenous African blood running through my veins, and that's a very complicated history. And we've mentioned ancestors. I think all of us have mentioned ancestors. This panel is very deeply rooted. and one thing that I want to say when it comes to the work that we're doing is that I said it on the panel earlier today. The way that the system has failed Black women, it's more than just failing one demographic. It's a failure to humanity, and it's a failure to, it's honestly, it's a curse on humanity. When we talk about ancestors, I know for a fact my ancestors don't play about me. And so thinking about just me, if you think about the hundreds of thousands of Black women who have been abused, like, we're seeing the results of that. This world is in chaos. And if you want to know why, that's why. In my opinion, that's why, and that's part of the reason why I'm doing this work. What else can I say? I mean, I'm here. I'm a Black mom. One of the things that has been very apparent to me as I've jumped into this world and begun doing this work is that every Black woman who I have had a conversation with who has experienced pregnancy has a story. Every single one. There is not one Black woman who I've spoken to that has experienced pregnancy in any way, shape, or form that has not experienced some form of racism, discrimination, abuse, being lied to, being not listened to. Like, the list just goes on and on and on and on. And a lot of us in the birth work world entered that world because we decided that we were not going to allow that to happen to other people, what happened to us. And that's, it's so important to continue this work for that reason. And I said this as well this morning. The reason that as traumatic as it is sometimes to be in that hospital, I'm not gonna lie, because working in a hospital and seeing it day in and day out, it gets to be a lot. But at this point, I'm standing guard because we have to stand guard for each other. And that's why I'm in the hospital doing what I do every single day.
Thank you for that, and we all play a role, and I just want to say thank you, Shawnee, for being a part of the documentary, sharing Shawnee with us, your family with us, and continuing to be in this space. And I know you were in this space before this happened, in the reproductive space, but understanding that, yeah, you can clap that up, sorry. but it is traumatizing, and I would like to think that every single person that's sitting in this room, one, that you're committed to anti-racism.
Absolutely.
Right? That understanding that this epidemic is rooted in white supremacy and racism, and that the only way that we really can see a system change and save lives is if we combat it head on and be unapologetic about that. And so this is a conversation. We have some questions from the audience, and as we move through them, if people have some, you can continue to write them down. And so my first question, as I set the tone that everybody in here is committed to being a co-conspirator in dismantling anti-racism, what sets Root apart from hospitals? I did this on purpose. I know what I'm doing. What sets Root apart from hospitals and the standard of care that results in the loss of life?
Yeah, that's a setup question.
I don't know who asked the question, but it was a great question. I mean, all these are great
I don't know
questions.
who did either, but they clearly have an answer already. So, Jatu, we got your back. All right? Saying it publicly. Commissioner Crawley, we love you.
I love you too.
All right. What set Root apart? You want to go first?
No.
So, in all seriousness, Root is a public health organization. And we're a public health organization that focuses specifically on addressing the epidemic of infant and maternal mortality. And so what sets us apart is we are not this catch-all organization. We focus specifically on Black family health inequity in the maternal and infant health space. Period. Unapologetically. Joyce, stop laughing at me. But if we do that in a way that places the families first, we do not assume that our families come to us with deficit, because they don't. They come to us fully empowered. Our job is only to support their re-empowerment.
Absolutely.
So that part right there sets us apart from any hospital system that we do not own that you're going to attend. And it from that perspective, from that point, it just moves into a whole lot of other places. We hammer medical professionals in hospitals on making sure that they provide accurate health information. There's so much erroneous health information out there that if I had $1 for every time we had to fix and correct that, we would not have to work ever again. It's that prevalent here. What else sets us apart? We create relationships with our families, built on trust, built on understanding, built on engagement, with a foundation of respect and love across the board. What else sets us apart? We make sure that we have wraparound supports for our families. It's not just about labor and delivery.
No.
So as far upstream as we can get connected with our families, we engage them, and we do that on a repeated basis, on a monthly basis, on a weekly basis, depending on whatever is needed. We can continue engagement with our families from prenatal all the way through labor and delivery to postpartum up to 5 years of age, if in fact we want to do it, or if the family wants to do it. We also put in place a nutritional program for our families. They're obligated to participate in that. There's an accountability. When you're pregnant, when your family's pregnant and you're expecting, there's an accountability you have. You have a responsibility. So you can't do Chick-fil-A and tell me you ate today. You can't Popeyes yourself to death. We're not doing that. You're not going to hypercarb yourself to death. So us having focus on the nutritional values are different in that way. Additionally, and this will be the last point because I know she's going to jump in and say something, we pay attention to the nuances in your clinical labs. We don't just assume that the lab value you received qualifies you to just be in this category simply because you're Black. Simply because you're this certain age, or simply because you come in with a certain weight. We go through every bit of those tests with a fine-tooth comb, and I can't tell you how many times we've had the opportunity to reverse what hospitals or doctor's offices call a diagnosis, or reverse a course of care, or reverse the fact that they want to push for inductions, which is crazy, or they want to push for C-sections, which are not necessary, or don't want to do what when they are, or want to do invasive examinations when they're not necessary. Happens a lot. So those are the things that set us apart from what occurs in hospitals.
all of that. And typically, I like to be the one, this is the thing in the office, right? Like, I like to be the one to break down all of the clinical stuff. So I literally will run it, like just looking at everything, putting the pieces of the puzzle together, being able to say, this is what connects to this is what looks like, this is what we need to look at, this is what we're calling the hospital about right now. It's 3 a.m., I don't care, get the administrator up, we've got to figure this out, right? And I also recognize that I do that, this is more of a conversation with he and I, that I do that because it's the really safe space to be in, because it allows me to continue to do the work that we do and not ever have to really deal with the acknowledgement of some of the reasons that we came to the work. And so, again, I'm probably not going to get into it really deeply this evening, but what I will share is that what sets us apart is the things, the relationships and the things that we develop. Like the very first time you and I had a conversation, we were referred to one another for business, right? Trying to put some things together. And we ended up having a conversation for about an hour. So what you're looking at are two mothers, both who had children that had pulmonary embolisms during their birth experience, and then had different outcomes. But both that had to fight in that space and had to try to maintain being the professional, but wanting to just be the mother and the grandmother, and having to be the one to make sure that things were taken care of and they didn't all get taken care of. That's what sets us apart, is that at the end of the day, we're not concerned about the title, we're not concerned about what your degree is, we're not concerned about where you come from, we're not concerned about what last speech you gave, we're not concerned about any of that. We're concerned about us and caring for our people, and knowing that the work has to continue even through some of those tragedies. Because if we're not the ones to speak for us, it's going to continue. Folks will continue to try to find ways to be able to duplicate what's happening instead of actually just listening to the people that are doing it and how it is that it needs to be done, and getting out of the way so that we can continue to do the work that we need and bring up those that we have those relationships with that now want to step in and do the work themselves. We have these gifts that we've been given by our ancestors. It's our responsibility to pass them down and to answer those questions. So that's what sets us apart. We are who it is that we talk about, that we treat, that we take care of. We are that Black family.
Thank you. Thank you, Jessica and Dorian. So Jatu and Shawnee, if you can answer this question, it's a two-part question. For young Black women who plan to have children, what can we do to prepare ourselves? And how can we advocate for ourselves to our doctors?
So this is a mixed bag for me. I think it's totally unfair to be pregnant, navigating life, and more often than not, if you're a Black person, an Indigenous person of color, you're working a job, you're taking care of other people. I think it's totally ridiculous, crazy, over the top for me also to have to advocate for myself. And I'm pushing a baby out, and I'm like, can you, don't touch me, like, that's insane, insane. So any forums that I go to where folks are like, oh, we need to teach, mothers or birthing people how to say this or do that, I'm like, no, we need to make sure that everybody in the community is doing what community is supposed to do, which is to cover, hold, make the bone broth, rub the feet, do all the things. So I'm calling upon the community to cover the mothers or birthing persons to be, to do what we need to do to make sure that the information and the education is shared, and the love predominantly, without judgment and all this extra stuff. We've forgotten how to do that, and we have to restore that. You mentioned, so there's a lot. I'm a clinician, I'm a psychotherapist, I've been in the field a very long time. I'm like, if we don't tell our stories, ain't nobody gonna tell them, and we're gonna get sicker. So I don't have it that this is too traumatic, right? Maybe that's my bias. I'm like, this is a story of joy. Did y'all see that Black birth? Joy. Did y'all see that baby coming through? in peace and love, being able to lay on top of her mama's chest in the couple, like black love in action with support. So, right, doing exactly what they are here to do, right? So I think about that. I think about the fact that there is a forum for us to tell our stories, that I stood in a space where Martin Luther King stood 57 years before. And I'm sad that it was about what it was about, but I'm like, yo, I come from an amazing dope-ass history. So we need to be, we do. And white folk, y'all are part of that too. You are. And so I think it's very, very important for us to share our birthing experiences with young people, from elementary school, as young as they are, as old as they are, to understand, contemplate what you're saying. My daughters knew their birthing stories when they were single digits old. They knew their story. They knew the stuff that didn't feel good and knew the stuff that felt good and was great, the time that they were born, their weight, all of that. When do we stop telling the birthing stories as part of ritual and tradition and ancestral acknowledgement? Because we all been here before. We just keep coming back again and again, and we're gonna keep coming back until stuff is set straight. So those are the things I want to say for right now. It may not be the checkbox or the clinical thing to say, but that's not what I'm called here. I can say all those things, but I'm called here to let y'all know, no matter how you identify, that if we don't tell the stories, go back to our roots, restore the rituals, get out of our heads, bring it down to the heart, to the spirit, to the gut, to the womb, then we're gonna keep cycling in and out of this traumatic insanity.
So I guess from a clinical perspective, what can Black women, Black young women do to prepare themselves for the birth experience or the perinatal experience? For myself, what I did, I'm gonna use my example. I'll be very honest. When I'm looking for a person to take care of me, I want that person to be a Black woman. And so I went on, I had just moved to Ohio, and the first thing I did, Black woman OBGYN, and I found one. You don't realize how many choices that you have until you look for them. When it comes to perinatal support, organizations like Root, there's several organizations out there that provide perinatal support. Find those organizations. Get that support, because like Shawnee said, you shouldn't have to advocate for yourself. There are people out there, there's community, there's village. We need a village. It takes a village to get through a pregnancy and to continue through that postpartum period. Get that village, grow that village, build that village, and continue and keep it, through your childbearing years, so that the next time you're pregnant, call them up and say, listen, I'm pregnant again, I need you guys again. And keep those relationships going. Just like Jessica said, those relationships continue. It's not like you said this morning, postpartum is forever. Those relationships are also forever and should be forever. So building those relationships and just making sure that you have people advocating for you and have that strong rooted village is very important.
Thank you for that. I was just having a conversation with Dayla about having a Black OBGYN, and I was trying to find, I had someone different. I'm looking for a Black OBGYN, found one, called last month, and she doesn't have any availability until November, December. And that's the issue. We don't have enough Black OBGYNs or Black practitioners.
And when we have them, we can't keep them.
Right.
Because of how they're being treated.
Right.
Which is, which leads into my next question, so thank you for teeing that up. Where is Ohio or Columbus, and I can answer a little bit of this, with birthing centers? Where is Ohio with birthing centers, and where are the hospital systems on this issue? Can I answer that? Absolutely. This is a conversation, so we can jump in.
Oh, we can do that?
wherever. Yeah.
Okay.
This is a
Will
conversation.
this be televised? I don't want to lose my job.
I'm
kidding.
I told you we got your back.
Okay, I
All right,
appreciate
go.
that. I have been trying to get my facility to transition to a natural birthing center since I started. And I'm only one voice. I don't know where it's gonna go, but I'm gonna keep fighting until it happens because it's needed. I do know that there's gonna be a freestanding birthing center being built in Dublin soon, which I have opinions about. I have opinions about a lot of things.
I mean, you can have that conversation.
I don't necessarily know that location is the right location for the need. It's not. It's not being built in the appropriate location at all. Dublin doesn't need another hospital. Let's be honest.
No, 3 of them being built right now.
Right. So, when it comes to the birthing center and what we're doing, we're not really doing much, let's be honest. We should be doing a lot more because the birthing center model, what it does, just like the woman said in the video, in the movie, it provides as close as possible to the home birth experience for women who don't necessarily choose that route. While also, sort of incorporating the safety aspect of the hospital birth, even though, how safe is a hospital birth when we're dying? But, there's something to be said about the birthing centers and what they bring, and unfortunately, we're not really there yet.
Yeah, so I want to jump in on this because it's an important conversation, but also want to get really clear about some things, right? Because I've had the opportunity to do births in hospital, at home, and in birthing centers. First thing is, we cannot allow, stop with my finger. First thing is that we cannot allow and we have perinatal support doulas. But we can't allow conversations that say having a doula and having a birth center are actually going to be the answer to all of the issues. Because unfortunately it's not. And so then it becomes this pop culture thing and everybody starts rushing to try to do this thing but not really understanding what it is that needs to be done for us and to take care of us, right? Because the problem isn't where we birth to a certain extent. It's also a problem with where we birth, but that's a different conversation. The problem is that further upstream, we're not talking about how it is that certain things like your nutrition, like how much sleep you get, like your stress levels, and how they actually relate to the labs that we have, cause the problems that are killing us or cause long-term morbidities. To make it even more plain, there's no reason that postpartum hemorrhage should be the #1 cause of death for us, because if you literally just take a look at a lab and a doctor doesn't look at it and go, oh, well, that's normal because you're Black, we typically see a lower hemoglobin level, and actually address it, then we don't get there. That's what makes us, again, different. We don't have the conversation about how we can do emergency management in those situations. We have the conversation about how we're never gonna get there. So if we're going to have birth centers, we also need to make sure that we're having a birth center that's actually going to address the needs that we have as a people and a community, and be able to understand and make those connections about how it is that we can be healthy and how things aren't normal for us. It's not normal just because we're Black. It's not appropriate. It's not okay to have different ranges or go, well, this is okay for you because we see these trends. So at least you're not at the trend.
Right.
It's not all right. And it definitely isn't okay to be building a birth center that is in the middle of a neighborhood that really doesn't have anything to do with us and is private pay and doesn't have access to most people. That's not gonna help.
And I'll add,
I'm sorry.
Jatu, you wanna go?
No, I wanted to give an example of what you just said. When I was pregnant with my second, I had a hemoglobin of 8, and because I had a Black midwife, it's the only reason that I was pushed towards getting iron transfusions prior to giving birth.
We have to make the
And
referrals
the reason I didn't die.
Right,
And really,
we
the
have to
reason
make
I
the
didn't die.
referrals to the hematologist because they don't want to do it because it looks like it's okay.
The amount of fights that we get into in these hospitals is ridiculous, but that's a different conversation. To answer the question about birth centers real quick, institutional systemic racism doesn't turn off because you flip a light switch or build a building.
That's it.
Let's understand that. all of those values, those mores, those ethos, they go into that center. And the fact that it's positioned where it is tells you exactly what the intent behind it is. So to Jessica's point, we talk about this all the time. It's not just about a doula. It's not just about a perinatal support doula. It's not just about a birth center or a fact that you want to change your hospital around. That stuff doesn't change overnight. So if we act as if we think that it does, they're going to continue to do what they do. At the end of the day, it's not going to be helpful to us.
I just wanted to, is it okay? I wanted to hold us accountable. I said it in the earlier forum. People don't always get why I say this. They're like, what's wrong with this black woman? But I know that I've been bred to be a white supremacist in a black body. Yeah. Right? And only you agree, so sis, we can talk after.
Absolutely, I got you.
And I joke about this, but I'm also dead serious. I'm like, the white supremacist that lives in me is a little old white man with a bent over back, and he has a bad attitude, and he's very judgmental, because I've been institutionalized. I was told that when I was young that I was bright, put in gifted programs, separated from other students, set apart, you know, going by the numbers. I would cry if I got a 95 on a test. Real craziness, right? Since I was a little girl. And so I've been indoctrinated to listen for broken English. I see people nodding and, you know, oh my God, what they write on paper, it's like, oh, they used the wrong word, or it's misspelled. I have to reel my white supremacists in. Just straight talk. So I'm like, yeah, those birthing centers, and I hear y'all saying, and agreeing to what we're saying, but it's us. Us that goes into the institutions, and sometimes us looks like the people who we're serving, just like them, melanated, the whole 9 yards, and judging and pushing the agenda, the Pitocin, the C-section, and all the things. Absolutely. All the things. And so I want us to be accountable. Erica was being very generous earlier, and we were all murmuring over here when she was like, oh, everybody here is anti-racist. I'm like, no, they're not.
No, you know I know.
It's okay. You have to say it. Yeah, it takes work to live like this. It takes work to be checking people. It takes work to be like, raising your hand.
And sacrifice.
And it doesn't make you popular.
No.
They don't like you.
And it's exhausting.
Yes, it is.
It's exhausting. And then being in a space where people are supposed to be anti-racist because they checked the box and took the workshop, and then I'm saying stuff and they sitting back, and then when we go in the bathroom, they're like, girl, I agree. I'm like, get out my face. Get out.
You don't get to talk in the closet.
Right. So I just wanted to put that out there. We're all accountable and responsible for transforming. It's a daily practice. It's not a workshop. It's not a training. It's not a video you watch. It's not online learning. It's everyday practice that begins with you.
Yeah, no, that's good. I mean, we have these ongoing conversations at the county. We'll just be transparent. I know everybody in here isn't anti-racist, but we have a mandate at the county where racism is a public health crisis. We address it head on. There's no going around Joe's barn to make people feel comfortable. As long as I am a commissioner and I gotta be uncomfortable showing up every day to do my work, then other people are gonna be uncomfortable too addressing it. Because I can't be the first Black woman elected in 220 years, and then I gotta carry the mantle, and I gotta, it's heavy. It's gonna be a shared responsibility, and I'm glad that I work in a county with county commissioners and administration that understand that. Because I got 4 years to be here, and I'm not gonna be uncomfortable just because I'm a Black woman existing in this space. So, but I do want to say real quick as we move on, and I know I got 8 minutes left, before we have a reception. When it comes to where the hospitals are on birthing centers, I think and Jessica and Dorian know this all too well just from the work that we were doing in the legislature. One of the bills that I had was Save Our Mothers Act, right, which made sure that doctors and nurses or anybody that was coming in contact with a birthing person had to, as part of their continuing education credits, had to take anti-racism, cultural competency training, and we know that don't always do anything, but that was a mandate for the hospitals. But it also required patient safety bundles, right? And so we know in states that have adopted patient safety bundles, which look at, if they're to assess for like hemorrhage and hypertension or vascular issues or mental health or addiction, like all of these things that when they're in place, that the maternal mortality rate drops by 50% at times, and the infant mortality rate drops, and the hospital association was against that. And so, if you are working for a hospital, not outside of you, Jatu, I'm sorry, but I'm not sorry, because you're doing your part, right? That they can be obstructionists in this space and in this work. And so that is one way. So I know people want to know where the hospitals are on some issues. I don't care, because they could be in a different place and they could be an ally and really working to move the needle in this space in a different way. And unfortunately, we don't always see them show up. And so my colleagues and I have been very straightforward with a hospital that asked for some funding for a different initiative, but we used that opportunity to address the maternal mortality rate that is happening in the county, but also addressing how during the pandemic they made it hard for people to have doulas in midwives. So here you are asking us for a significant investment for a hospital, but also is counterproductive if we're also using dollars and investing to save lives when they're going into a hospital system where their life is in jeopardy. So, one of the questions was, what is Franklin County doing in this space? That's one of the things that Franklin County is doing. There's others.
Real quick, and this is to you. She brought up the pandemic, and we remember them restricting us having access to our families within the hospital. I forget where we were, because we're all over the country half the time. But we remember getting up, getting pissed, doing what we typically do, cussing at the walls in the air and at each other. And we called Erica and said that we needed to get something out to make sure that we're able to get into the hospitals to deal with our families. And she got up, she answered the call, addressed it, and we were in there within a 48-hour period. So that's the kind of commitment and dedication that is there. I just want to make sure I clear that out there, because you are and have been a champion.
Well, thank you. I appreciate that. And that was at the State House, but like I said, I get to work with county commissioners and an administration that supports this work in a real way. And so that's one of the things that we just did as we were making that investment. We addressed some other issues, but there's more. But one of the questions, and whoever can come in and speak to this, that would be great. What, if anything, can managed care plans do to cover doulas or midwives, especially when we don't have a state law?
They can, managed care plans can be more receptive to, let me answer in two different ways. One, managed care plans can be more receptive to understanding that the necessary work and funding that has to go into actually paying for the work needs to be there. So the argument is always that, well, it should be within this particular price point, and if you're asking for this amount, then you're asking for too much. But they don't consider the fact that if you utilize the services of people that really have the outcomes, then you're going to decrease the cost over time and the immediate inside of the hospital. So you're actually lessening the burden. You're listening to families and what it is that they need and what they want. The other thing that managed care plans can do is actually trust and believe that these treatment plans or modalities or whatever the case may be, that what it is that we do actually works, and that it actually works without us having to experiment on our families to show you that it works.
Which we have been asked to do.
You don't get to do a pilot and say that we have to conduct research on Black people, and so that you can show that one thing works and the other doesn't. We've been doing that for way too long, and nobody needs to do that any longer, and we most definitely are never going to do that.
That's always that evidence-based. We need evidence-based.
Believe us and then pay us a living wage for what we do.
And get out of the way.
I only have 2 more now. I got less than 5 minutes. If anybody can speak to this really quickly. One of the questions is the maternal mortality, the maternal mortality rate of American Black women, mothers affecting new Black immigrants is incredible. What is it about the USA that this change is happening and with no prior history in their families back home?
Racism.
Tried
it's
and
racism.
true, all through and through.
Systemic racism.
Racism. You know, I mentioned in the morning forum that the portion of the movie that impacted me the most was when that midwife discussed the history of midwifery. And what I forgot to mention is why I said I had a little bit of a panic attack, but I forgot to say why. And the reason that I had a mini panic attack when I watched that scene is because what clicked for me in that moment is that, you know, we use these terms that, you know, racism is embedded into the system, or racism is, you know, interwoven, whatever the words we use. But that's not it. Racism built the system, racism is the system, and the system is racism. So like, and that distinction needs to be made, and that's why I had a panic attack, because I'm like, well, shoot, I work in the system. So, right, and it really, you know, it causes this moral crisis almost, and you sit there and you're just like, what do I do? What do I do to make this better? And you can't just sit back. That's for sure. That's for sure. You can't just sit back. You have to do something, and that's why I'm here having these conversations, because there's got to be something that we do.
The system isn't broken.
Not at all.
It's doing exactly what it was built to
Oh,
do.
yeah.
It's working
It's working just
perfectly.
fine.
Right.
So we have to step out of what that system is. We have
Exactly.
to be able to take care of ourselves and create our own.
Exactly. We need to build our
We need to create
own
our own.
systems and our own infrastructure. It's not going to change. It's not. And if we sit here and try to tell ourselves that it is, we're lying. History has shown us time and time again, it does not work. It does not work. And it's okay that it does not work. We know how to make it work for us, and we need to do that.
So as we wrap up and get ready to go into our reception, and sorry if I didn't get to your question, and the panelists and I will be around if you want to ask your question specifically to individuals, that opportunity is there. But if, as I go down the line, if you could just leave us, the audience members, and thank you all for being here, with one thing, would you be willing to share that? Jatu, if you want to start. Or if whoever wants to jump in, I don't want to cause any pressure, but if you could leave us with something, what would you like to leave us with?
We have to understand how complex this issue is. The slave industrial complex created an opportunity for agriculture, academia, business, shipping and logistics. You follow where I'm going? The legal system. All of these institutions to be complicit in the very system that gave birth, pun intended, to this dysfunctional crap that our families deal with every day. And if we don't understand how licentious it is and how ignorant it continues to make us, then we're losing it. We're not that many years away from Jim Crow. We're not that many years away from it. So I leave with that, is that we have to understand what we're dealing with. And there's a lot of scholarship out there on it. Dr. Ani talks about the epistemology of racism. Dr. Wilson talks about the definition of racism. Clearly, it's about a page paragraph long. Dr. Cress Welsing talks about the same thing. These are black scholars that you probably ain't heard of because they don't get the mainstream conversation. But we have to understand what we're talking about, and then understand what it can and cannot do, and then go do for ourselves.
I'm going to just add on to that, because it is one of the most important things in this conversation that we need to have as we continue to discuss how we need to do for ourselves. There has never been a time since we have been forcefully brought to this country that our bodies have not been utilized as a commodity. From the beginning to now. And if you look at it, during the period that we were enslaved is probably during the period that we received the most health care, the most reproductive health care, even with it being in torturing. that we ever received because they had to keep our bodies healthy in order to continue to reproduce us for their commodity. And when it cannot be utilized in that same way, you still have to utilize our bodies in order to be able to make some type of money from it. We are the commodity, and that is part of what the system does with us across the board. Regardless of what end of the spectrum, we have to understand that. And once we do, then we start to understand our own autonomy, our own innovation, our own ingenuity, how it is that we have the things that have been utilized to create some of these systems and then used against us, and we have to move into making our own.
So I have two things to add, since we continue to add, I love this. So the first thing is that we're all stakeholders and we're all gatekeepers. And I always say that if you came from a womb, if you have a womb, if you know someone with a womb, you need to be a part of this conversation. You're accountable, you're responsible, show up. And I love this brother, Neely Fuller Jr.
Yes.
If you don't understand racism, and I'll add white supremacy culture, what it is and how it works, everything you think you understand will only serve to confuse you.
That's a bad brother. Yeah.
So I guess what I'll leave is with this. Death is a part of the human experience. So death is going to happen, right? Preventable death even. You know, we were all put on this planet to take care of each other, and sometimes we do a terrible job at that. So preventable deaths are even going to happen for that reason. But what I can no longer sit by and watch is the preventable deaths that occur that affect my demographic because somebody, centuries ago, decided that my people were 3/5 of a human being, and that has perpetuated over the centuries, and now black women are dying at a rate that's disproportionate to our white counterparts, and it's something that I cannot continue, and like I said earlier today, I can't continue to say that I'm proud to be a labor and delivery nurse, to say that I'm proud to be a part of the healthcare system that is failing black women in this way. And so that's why I'm continuing to be a part of these conversations and will continue until I no longer have to.
Thank you. I will just leave with this, and my Deputy County Administrator, Joy Bibbins, will probably chuckle because we are in a conversation about our early childhood strategy. And I'm like, we can't talk about third grade reading guarantee if we're not talking about black women still living, you know, not dying during childbirth. But we can't talk about workforce development if we're not talking about that black women and Hispanic women are dying disproportionately during childbirth and after. Like, I am unapologetic that we can't talk about any of these things if we're not addressing that people are dying from preventable deaths, just like the data showed in the documentary, 60% of deaths are deemed to be preventable. That's the same here in the state of Ohio. 17% of the live births black women made up, but they made up 34% of the deaths. So we can't talk about anything if we're not talking about how do we solve this problem as a collective. And so everyone in here is a stakeholder. I would hope that everyone leaves here saying, I want to be a co-conspirator in dismantling racism, however it shows up, and that you check your own self and how you show up in spaces and address, are you being racist or anti-racist, and being willing to be in conversations that may be uncomfortable so you can be a better ally in this space. And so that is my call to action for you. The second one is when there is legislation at the local level or at the state level and the federal level, it burns me up that we will work night and day.
That's right. That's right.
Take a breath.
Take your time.
To put forward legislation, and there is nobody standing behind me to come and give testimony and say why this matters. You cannot tell me you care, and then when it's time to show up, you're not there. So if you care about the lives of your friends, family members, your community members, then you will use your voice to tell your legislators why this legislation needs to move forward in today and not a day later. Because a day later is a death that happens unnecessarily. So I thank you all for being here. I will turn it back over to our great host, Mr.